Hello and welcome to New Mexico Rising. My name is Dan. You know, each and every week I try to bring people from across the country to talk to me about cool things we could do right here in New Mexico. On this week's show, we got this.
When it comes to an opioid overdose, the three key signs that we want to look for are...
Even as humans, our needs change, right?
All that and more right here on New Mexico Rising. Facing the itching and discomfort is a reality for millions. Yet the journey to treatment is often a silent struggle. So today we're peeling back the layers of what can be a common condition with Dr. Raj Chovatiya, a leading voice in dermatology from the Rosalind Franklin University and the Center for Medical Dermatology and Immunology Research. With new advancements in breaking decades of silence and treatment, Dr. Chovatiya sheds light on the path not just managing, but understanding the destigmatizing of seborrheic dermatitis. So let's dive into the science, the solutions, and the support available for those affected. Welcome to the show, Doctor. How are you?
I'm good, thank you. Thanks so much for having me.
Let's hope I said that correctly. What is seborrheic dermatitis?
Sure. So seborrheic dermatitis, or here's the trick, sebderm is what we all typically say, is a chronic inflammatory skin disease. And so that inflammation in the skin manifests in a few common ways: red patches, large, greasy, flaking, yellow scales, and persistent itch, oftentimes in highly visible and cosmetically sensitive areas: the scalp, the face, forehead, eyelids, eyebrows, beard, neck, and even the chest and back as well. And it's really the visibility of those symptoms that's tied so strongly into some of this social stigma that you mentioned, as well as negative self-image and low self-esteem for our patients. And, you know, the interesting thing is, despite being such a common condition, it's estimated at least 10 million individuals in the US actually have seborrheic dermatitis. Many folks don't recognize the symptoms and don't necessarily get to their healthcare provider in time. And so it can take them years actually to get a diagnosis. And that's the reason why I'm excited to be with you today and partner with Arcutis to not only raise awareness about seborrheic dermatitis, but also talk about a new treatment option in the case of Zoryve foam.
So what are some of the challenges in treating this condition?
Yeah, so there's a few that come to mind based on the work I do with my patients. And one big one is that you often have to prescribe multiple products for multiple different parts of the body, each with a different set of instructions and different lengths of time. It's kind of exhausting even saying all that, but this can actually make the entire process very complicated for patients. And with hair-bearing areas, oftentimes using creams, gels, and ointments is quite difficult and is just not going to cut it. And so a lot of patients just haven't been satisfied with their treatment options for seborrheic dermatitis to date.
All right, so what are some of the treatments available for people living with, I'm going to say it, seborrheic dermatitis?
Yeah, so for the first time in 2 decades, we actually have a first-in-class prescription topical foam that was approved by the FDA specifically for the treatment of seborrheic dermatitis. So let me kind of review some of those high points. Zoryve, or roflumilast, topical foam 0.3%, once daily steroid-free foam approved for seborrheic dermatitis treatment in individuals 9 years of age and older. So this is adults and children. And the interesting thing about this medication is that it targets an aspect of inflammation that's specific to seborrheic dermatitis. And it can be used anywhere on the body, all skin and hair types. And the foam itself is water-based and fragrance-free with no common irritants. And another important point to mention is in the clinical studies itself, the most common side effects that we're seeing include common cold, nausea, and headache.
Okay, where can we go for more information on seborrheic dermatitis?
So to really see if Zoryve foam is right for you and talk about seborrheic dermatitis, first thing I always recommend, talk to your healthcare provider, especially in light of some of those symptoms that we mentioned. You can also visit Zoryve.com, that's spelled ZORYVE.com, for full prescribing information, important safety information, and just really good background information on seborrheic dermatitis itself.
Well, thanks for joining me this morning, Doctor.
Thanks so much for having me.
March is Multiple Sclerosis Awareness Month, a time to shine a light on MS. It's a disease that affects an estimated 900,000 people in the United States. So today we explore a less talked about and often misdiagnosed related condition of MS called PseudoBulbar Affect, or PBA, which may cause sudden, frequent, uncontrollable episodes of crying or laughing in patients with MS. Joining us is Dr. Mayor Joshua Hasbani, a renowned neurologist, to share insights from his own clinical experience with patients who experience PBA. Welcome to the show, Dr. Hasbani.
Thank you for the opportunity to speak with your viewers.
All right, can you explain how PBA is connected to multiple sclerosis and why it's important for patients to be aware of this condition during MS Awareness Month?
Yeah, so multiple sclerosis is a chronic disease of the central nervous system that affects, as you said, nearly 1 million people in the United States. In patients with MS, the immune system cells that normally protect an individual mistakenly attack the central nervous system, which interferes with the transmission of normal nerve signals between the brain and other parts of the body. And that leads to the symptoms that patients with MS suffer with, including weakness or numbness. But one of the other conditions that results from damage to the central nervous system is called PBA, or pseudobulbar affect. And in this condition, patients have uncontrollable, sudden, involuntary, frequent, and disruptive episodes of crying or laughing. And these episodes can be exaggerated or don't even match how they feel on the inside.
So, how is PBA different from emotional disorders like depression?
So PBA and depression have overlapping symptoms, particularly crying. In depression, crying occurs as a result of the patient actually feeling sad on the inside, and they can usually control the crying, and the amount of crying is congruent with the amount of time that they are feeling sad. Unlike that, however, in PBA, patients have uncontrollable episodes that can be triggered by something in their environment that is slightly sad or slightly funny, and their response could actually be opposite to the situation. Something sad that they see on TV can lead to laughing or vice versa, or it can be an exaggerated amount of crying that can be very loud. And as a result, these episodes are disruptive because they occur at times that can be inappropriate. And as a result, the patients may have social isolation. They may not want to go out in public. They may be embarrassed at work. And so treating that is very important. Recognizing it and treating it is very important.
What challenges do patients with MS with PBA face, and how can they be addressed?
So patients with PBA have these episodes, and these episodes can occur at times that are inappropriate. And as a result, it can be embarrassing, and that leads to social isolation. So treating it is very important. There is an FDA-approved option called Nuedexta, which is a combination of dextromethorphan and quinidine sulfate that's been clinically proven to reduce episodes of PBA. While the most common side effects were diarrhea and dizziness, these are not all the risks from Nuedexta. For instance, if you're taking any medications that contain quinidine, quinine, or mefloquine, or monoamine oxidase inhibitors, or if you've ever had an allergic reaction to those medications, it's suggested you do not take Nuedexta. Further, if you have any personal or family history of heart disease, myasthenia gravis, and take any other medications or supplements, it's important that you speak to your doctor to determine if Nuedexta is right for you.
So are there any specific treatments available for PBA?
So the treatment that is FDA approved for PBA is called Nuedexta, and it's a combination of quinidine and dextromethorphan.
All right, where can people go to learn more about PBA and Nuedexta as a treatment option?
So for more information about PBA and Nuedexta, including full prescribing information and important safety information, please visit treatingpba.com.
Thanks for joining me, Dr. Hasbani.
Thank you so much for the opportunity.
You know, 4 years ago, the world was locked down, and we were all looking for ways to make life a little brighter. Nearly 1 in 5 American households adopted a pet, and today, pandemic puppies and kittens are fully grown, and pets adopted as adults are kind of approaching their senior years. Just like their humans, their needs kind of change as they get older. So today we have Kathy Buccio, a lifestyle expert, TV host, and dog mom, who here to share with us her own pandemic puppy, Roxy, to discuss how we can support pet health and wellness at every stage of life and ensure that they all have their best lives. Welcome to the show, Kathy. How are you?
Well, thank you for having me, Dan. And Roxy is here. She's ready for her close-up. We're so excited to be on.
Okay, so let's start with your story with Roxy. How did she come into your life, and what has she meant to you and your family?
Oh, Roxy, it was a love at first sight, Dan, when we met Roxy. She came into our lives a few months before the pandemic, and as you can see, I mean, if the painting behind you doesn't even give you an indication, she basically is the queen of our house, and she's just wonderful. She's so lovable. She's affectionate. She loves to cuddle. She's so great with the kids. I mean, we couldn't imagine our lives without her, but she's not a puppy anymore. So, she's growing and her needs are changing, and, we're changing along with her.
As our pets are starting to get older, how important is it to keep up with vaccinations and those routine checkups?
It's so important, Dad. I mean, it's just the same way that we go to the doctor and get our checkups and get our vaccines, so do our pets. They need that. And vets recommend a checkup once a year to really help prevent, and identify any conditions early on. And we have to make sure that our pets are up to date with vaccines. Now, whether they're puppies or a kitten or maybe they're senior pets, they still require regular vaccines to protect them. Now, Vetco vaccination clinics, they offer this new vaccine package that they're grouped by age and lifestyle for your pet. And now through June 30th, I want your viewers to know this, new pets to Vetco Total Care Hospitals, they receive their first routine checkup for free. So there's no excuse to sign them up. And if you're a Premier member, you receive unlimited routine vet exams and $20 Vital Care rewards for any exam that has to be done outside of Petco, right? We approve.
And pets need change at kind of different stages of their lives, right?
Absolutely. Even as humans, our needs change, right? So do our pets. So let's start with nutrition. That's the basic that we need for our little mascots. So puppies and kittens, they can benefit from specific formulations because we're focused on growth and we're focused on development. But older, more mature pets, they have different dietary needs and sensitivities. So they may require a switch to a food. Maybe it's more focused on weight management or food maybe with limited ingredients. And I hate to always say, because obviously our pets will get to those senior years, they may benefit from joint and fatty supplements that will really help with their mobility, with their joint, skin, and coat health. I have something for that right here that you can find at Petco. Now, the home adaptations. When you have a puppy, you're familiar with the puppy gates, you're familiar with the crates, the squeaky toys, and that's wonderful. And those are great. And as pets get older, we want to make sure that we bring in things like stairs and orthopedic beds. This is also a great adjustment as they grow into all the different stages of their lives.
And as life gets a little busier and a little more hectic, what are some of the key ways that we can prioritize and support some of our pets' health and their safety?
Absolutely. I mean, new routines and changes, they really increase the pet stress and anxiety. And listen, if you're a pet parent, you know that these behavioral issues can sometimes arise at any stage. I'll give you an example. During the pandemic and after, Roxy had a lot of separation anxiety. And she would get so overexcited. She would shake anytime I would leave the house or leave a room. And I would say, oh my goodness, what are we going to do? But we spoke to our vet and we got the help of a certified trainer as well. We were able to learn some really great techniques and tools to reinforce that positive behavior. And we still use that today. So make sure you speak to your vet about that. Another thing that's key is regular grooming appointments. Yes, we want our pets to slay and look amazing, but it's also important that we go because this is the first line of defense, really, in identifying issues that maybe needs to be evaluated by a vet. And this last one, let me tell you, this is one of my favorites, and I think every pet parent should do it, is register your pets with Petco Love Lost. It's a free national lost and found database. It uses recognition technology. It helps reunite pets and their families. And I'm going to add one more thing, which is microchipping. We hear microchipping. I absolutely recommend this. Microchip your pets.
All right. Microchipped. Hey, Haldy, are you microchipped and you're all set? Yes, he is. He's ready to go. All right. Where can our viewers go for more information and also even follow you on social media?
Absolutely. Viewers can visit their local Petco or go online to petco.com for more info. And you can follow me on Instagram at Kathy Buccio TV.
Kathy Buccio, thanks for joining me this morning, my friend.
Thank you, Dan.
In today's digital age, staying connected is more than just about having the latest smartphone or the fastest network speed, but it's also about like the extra perks and savings that come with your wireless plan. From exclusive hotel deals to major discounts on movie tickets and concerts, it's time to maximize the value of your mobile service. So joining us today is Cassie Slane, a leading technology and consumer expert who is here to unveil how to choose the right wireless provider that can unlock a world of savings on everyday essentials like luxury experiences alike. So let's give a warm welcome to Cassie Slane. How are you, Cassie?
I'm great. Good to be here.
All right. Can you tell us how customers can find the best reward programs to stretch their dollar and save?
Yeah, well, to start, think about where you're already spending money, so necessities like your credit card, insurance, your wireless carrier, many times rewards programs have offerings outside of their core rewards that you might not even be taking advantage of. So think about, those things that work for you. So think about your lifestyle. Maybe you like to travel, or you're a foodie, or you like to go to the movies. Find something that is going to give you that extra added value so you can save some money.
And can you share the latest, customer rewards included with a wireless provider?
Yes, I really like T-Mobile's offerings. They've been known to put their customer first, and they just launched their new Magenta Status Customer Appreciation Program. So what's great about this is it's packed with $1,500 of perks per year. So one-of-a-kind deals and experiences from nationally loved brands and services that you're probably already using, like hotels, your rental cars, your movies. Can get 15% off Hilton. And the best part about it is it's all right there if you're a T-Mobile customer. You don't have to pay any extra. So it's just like being a VIP without those extra costs. So it's great perks for you to save money and to get all kinds of fun deals.
So what should people be looking for in a wireless provider or a plan? I'm actually thinking about changing myself.
Yeah, so you want to make sure that not only is the wireless carrier working well in your area, but also that it's giving you that extra value and that it's working for you. So things like for the Magenta Status, you get a rental car. A lot of times you have to go fill it up with gas before you drop it off. Well, with this, you can go just drop it off at $1, for example, without refilling the tank. And that's something you can do whether it's, and if you have an electric vehicle and you're dropping it off at Hertz, you don't have to recharge it first. You don't have that hassle. You get to just drop it off. So it's those types of perks you want to look out for if you're thinking about switching for wireless carriers.
All right, Cassie, where can we go for more information about any of this?
Yep, so you can go to tmobile.com/benefits for more info on all the things you can get.
And how can we follow you on social media?
Look for me, Cassie Slane. I'm on Instagram and Facebook and all those little places.
All right, well, thanks for joining me this morning, Cassie.
Good to be here. Thanks, Dan.
In the fight against opioid crisis, the FDA-approved Opvi nasal spray emerges as a beacon of hope, targeting overdoses from potent substances like fentanyl. So joining us are Dr. Jerome Adams from Purdue University and Madeline Hilliard from Taco, sharing their expertise on this innovative solution and its role in saving lives. So let's delve into the future of overdose treatment with our esteemed guests. Welcome to the show, Dr. Adams and Madeline Hilliard. How are you two?
Great. Thank you for having us.
Okay, so how has the overdose epidemic changed over time?
Well, that's a great place to start. It's important to understand that 15 years ago, this was primarily a prescription opioid crisis. We then cracked down on overprescribing and diversion with tamper-resistant formulations and prescription drug monitoring programs, and people went to injection drugs like heroin. Well, now we're in a place where 90% of opioid overdoses and overdose deaths are involving synthetic opioids like fentanyl that are 50 to 100 times more potent than heroin. They're long-lasting and strong, and that makes them incredibly dangerous.
And the new aspect of this epidemic now that we're seeing that differs from several years ago is that it's not just those that are intentionally using opioids that are dying of an opioid-related death. It's actually people that are not intending to use opioids at all because fentanyl is getting mixed in with other illicit drugs like cocaine, counterfeit prescription pills, MDMA. So anyone who is using an illicit drug could be at risk for an opioid overdose.
I actually had a friend basically overdose on fentanyl from one of those vape pens. Didn't know it was actually injected in one of the vape pens that were going around, and they had to go to the hospital for it. But didn't. Luckily, they didn't pass away or anything have any lasting effects. But that is something that is at risk. How can you tell if someone is overdosing, and what are some of the signs and symptoms?
Sorry to hear about your friend. When it comes to an opioid overdose, the three key signs that we want to look for are, number one, the person's going to be unconscious, so they'll look like they're passed out. They're going to be, number two, they're going to be breathing very slowly or not breathing at all, which you can check for by placing your hand on their chest to feel for the rise and fall. And number three, they're going to have pinpoint pupils. That's the telltale sign of an opioid overdose, where the black part of the eye is very small and constricted. If If you see any of these signs, that's when you know it's time to call 911 and administer a reversal agent like Opvi or nasal naloxone.
So why is speed of onset an important attribute to opioid overdose rescue medications?
When it comes to an opioid overdose, the cause of death is going to start with the opioid causing the person to stop breathing. And of course, without breathing, we don't have oxygen. And so in the case of an opioid overdose, time is brain. Time without oxygen equals brain damage. So we want to make sure that people are getting these reversal agents able to breathe again as quickly as possible. Because when you administer one of these reversal agents to someone who is overdosing, you will literally see them go from being unconscious and not breathing to resuscitated and coming back. And so the sooner that we can get this administered to that person, the safer they will be, not only from death, but also from permanent brain damage.
So where can viewers go for more information, and how can we get some of these in places that are a little more public just in case something like this goes down?
Well, for more information, you can go to www.opvee.com. There's a standing order in your state that allows people to go and get this from a pharmacy and to get it paid for by insurance if you have insurance. But Madeline it has a great organization where they're making this available for free on college campuses in terms of opioid overdose reversal agents.
So for students to access free overdose prevention resources, they can go to tacoinc.org.
Well, thank you, too, for joining me this morning. And yes, my friend was actually sharing a pen that wasn't hers. So she tested it, used it, and found herself overdosing and had to go to the doctor or hospital right away. And because of them saving her, she's here today. So we're very lucky to have something like that to help save her life. So thank you guys for bringing this information out to our public today.
Thank you. And anyone can be in a position to save a life if you have an opioid overdose reversal agent like Opvi. That's the most important take-home message we want people to leave with.
Thank you, too, for joining me.
Thanks, Dan.
Thanks, Dan.
As car owners across the nation notice their insurance premiums are climbing, what are the reasons why, behind some of these surges? And are there steps that we could do to kind of help manage the costs? Well, today we have David A. Sampson, the leading authority from the American Property Casualty Insurance Association. He is here to explain the reasons behind some of the insurance pricing that is rising and hopefully give us some advice for consumers aiming to reduce their financial burden. Welcome to the show, David. How are you, my friend?
I'm doing fine. Thanks, Dan. Appreciate the opportunity.
Okay, so big question is, why are the main reasons auto insurance premiums are going up?
Well, there are several factors, but the dominant factor is insurance premiums are being heavily impacted by 4-decade high record inflation that consumers also experience and face every time they go to the grocery store or the gas station. The cost of parts and labor to repair vehicles that have been in an accident have just been rising dramatically. Auto labor repair costs have increased 20% over the last 5 years. Auto repair parts have increased 40% over that same period of time. And when you combine that with the fact that we're still experiencing supply chain disruptions and being able to get those parts in, that means cars are in the auto body shop longer. Rental car prices have gone through the roof. All of those factors go into auto insurance premiums.
So what do you think we could do to help lower our insurance premiums?
Well, we're not helpless, and there are things that individual consumers can do. So first of all, shop around when it comes time to renew your insurance policy. The auto insurance industry is a highly competitive business. Your viewers understand that. Every time they watch TV, they see how many insurance companies are advertising on there and wanting your business. So the first thing is shop around. Many different companies with different levels of service and profiles. So shop around, first of all. Secondly, be sure and talk to your local insurance agent. There are things that your local insurance agent can do to help you. Things like bundling your auto insurance policy with your home or renter's policy, maybe with your boat or motorcycle policy. Talk to your agent about increasing your deductible. If you're in an accident, yes, you'll have a higher deductible to pay, but your monthly insurance premiums will be lower on an ongoing basis. Ask your agent about discounts. Things like good grade discounts, especially for teenage drivers, can help reduce premiums. And then talk to your agent about what companies offer telematics programs that rewards good driving behavior. Things like not accelerating fast out of intersections or coming up to an intersection and braking real hard. Good driver discounts make a big difference. And then finally, if you're one of those people that you're just not driving as much as you used to, maybe you're still working remotely and you only use your vehicle primarily on weekends to go out and go to the grocery store or go out for entertainment or a restaurant. Ask about companies that offer drive or pay as you drive or pay by the mile programs so that you're only paying for the times that you're actually out on the road. All of those things are actions that we as consumers can take to help manage the overall inflationary environment that we're in right now.
Like, even if I haven't had a claim or a traffic ticket, why are even my premiums still rising then?
Yeah, so that's a good question. During the pandemic and the COVID restrictions, accident frequency and severity dropped as people were not on the road. But since the end of those COVID restrictions, both accident frequency and severity have returned with an absolute vengeance. The second reason is that as people buy newer cars, the cost of new cars are just so much more expensive than they were 4 or 5 years ago, about 40% higher. As you think about all of the technology that is embedded in cars today, some people say we're not driving cars anymore, we're driving computers that have wheels on them. And there's a lot of truth to that. But even in simple accidents, like a fender bender, you think of all of the cameras and sensing technology that are embedded in those bumpers and side view mirrors and windshields. As the price of cars and the technology of cars in cars has increased, the cost of insuring those vehicles also increased.
Oh, David, well, thanks for joining me this morning. Where can we go for more information?
Yes, if you'd like to dig deeper, go to apci.org/cost drivers.
David A. Sampson, thanks for joining me this morning.
My pleasure, Dan.
And that is it for New Mexico Rising. I want to thank you for tuning in and checking out the show. If you actually want to be on the show, all you got to do is email me. That's newmexicorising@gmail.com. Or go to our website, newmexicorising.com. Right now, we have a bunch of books on there from some of the authors that have been on the show. So if you want one of those books, all you got to do is just pay for shipping. It's available right now at newmexicorising.com. Follow us on social media, that is Facebook and Instagram, and we're doing some giveaways coming up in a couple of days for that Back to the Beach show over at Revel Entertainment Center, where you can dance like you are a teen again. It's going to be like a Y2K throwback. It's at Revel Entertainment Center, April 6th. We got tickets that we're going to be giving away on Facebook and Instagram, so follow us at New Mexico Rising. Just look up New Mexico Rising TV on both Facebook and Instagram and find yourself following us and maybe get yourself some tickets. And that is it for New Mexico Rising this week. Until next week, that was New Mexico Rising.